Yes, ma'am.
What is mental retardation? The term mental retardation is of recent origin and emerged after medical, biological, and psychological sciences accumulated enough knowledge. So it is not that very old. It is a very recent term. People earlier used feeble-minded or mentally deficit for the term mental retardation, implying that their conditions could not be improved and their cause was attributed to sin. See, initially it was thought that once you are mentally retarded, nothing can happen to you, no treatment will work. Because maybe you have committed some, bad, or your parents must have committed some bad deeds for which you are suffering. Or, we seen a previous karma. Your karma in your previous birth might have resulted in as a punishment, okay, in your this phase. So it could be heredity and other factors which are irreversible. What is irreversible? If you are carrying a faulty gene, no medical treatment can alter it. Our hereditary factors are something that cannot be reversed. So initially mental retardation was regarded as feeble-mindedness or mentally deficit, and it was thought that once anyone is mentally retarded, nothing can bring about any kind of improvement in the person, and the causes could be their bad deeds or it could be heredity, which are irreversible. It is only more recently, after the emergence of scientific methods of measuring intelligence and educational and training strategies, that there emerged a better understanding of the problem. Initially, people did not have much understanding about this term, as I have already mentioned. They considered, mental retardation as a punishment, which is given by God. So initially, only knowledge about mental retardation was restricted to heredity and your sin. But now what is happening, because of improvement in science and technology, because of improvement in measuring intelligence, and there are many educational and training strategies that have come up, which has provided a clear understanding, a better understanding, I should say, about this mental retardation term. A classic case in this context was that of a wild boy of Aveyron, a young boy who was found to be incapable of thinking, speaking, and many other adaptive functions, was identified and trained by famous psychologists like Itard, Senguin, and others. See, this boy, whose name is, who is known as the wild boy, he could not think, he couldn't even speak, he could not do anything on his own, he couldn't adjust. This boy was trained, this boy was identified and trained by famous psychologists like Idot, Sanguine, and others. Now, what was seen? See, in fact, Sanguine designed. Did you do a practical on Sanguine, this one, Sanguine form board? Have you come across this practical Sanguine form board, students?
No, ma'am.
So,
No,
a
ma'am.
psychological test which is designed by Sanguine. It's known as Sanguine Form Board. This is a test for measuring the IQ of children. Over the years, however, it came to be established that in many such cases, the problem was one of something is missing here. Okay, I'll fill this up. So, that established in many cases that the problem was one of taking this case under consideration, taking this case of the boy. Okay, Sanguine, he developed a psychological test which is known as the Sanguine Form Board test for measuring the IQ of children and classifying the children as mentally retarded or so on. Hence, the level mental retardation came into vogue. It is now reasoned that in most such cases, it is possible to bring about considerable improvement in the level of intelligent functions. Now, you see, mental retardation has 4 levels. Okay, suppose a child is in the mild level, mild mental retardation. Through proper training, through proper, adaptive skills, the many improvement can be brought about. But if the children or if the child belongs to the profound case. Profound cases, the case where the child cannot do anything, cannot do. It is the most severe, level of mental retardation. In that case, therapy might work, but many times it remains as a failure. But it is seen that children who are mild or moderate, okay, in the level of mental retardation, through adequate training, through different therapies, a considerable change can be brought about. Probably there are very few instances which are irreversible, arrested or retarded development, then a basic incapability. Okay. So in this thing, only one thing that you need to know is about sanguine, okay, who has developed the sanguine form board test, and this was developed to measure the IQ of children who are mentally retarded. Then after sanguine's thing, what happened? The levels of mental retardation came up, and it was seen that it is possible to bring about adequate changes in a child, okay, who has a moderate or mild mental retardation through proper training. Now, it is estimated that mental retardation is nearly 50% higher in males than females, probably due to Y-linked genetic conditions. You know now about the chromosome XY. Do you know? Yes?
Yes, ma'am.
XX girls and XY results in a boy. Okay. So mainly it is because of the presence of Y chromosome in males, which makes them more susceptible to mental retardation. A distinction is sometimes made between primary mental retardation, which contributes about 25% of the total population of retarded population, resulting out of genetic factors, chromosomal anomalies or differences in the number of chromosomes. So there is this primary mental retardation which occurs due to chromosomal anomalies. Chromosomes are what? What are chromosomes? It is a cell, it is a chain-like structure in the cell nucleus. Okay. So it is seen that out of this 50%, 25% are primary mentally retarded. And the reason behind is the genetic factor. It could be the chromosomal, aberrations or chromosomal anomalies or differences in the number of chromosomes. Like we say now, the Down syndrome, children who are with Down syndrome, they possess an extra chromosome. It is because of the extra chromosome that they are having this Down syndrome, or differences in the number of chromosomes. And the other group is the secondary mental retardation, where the causal factors basically relate to factors in the environment, both prenatal and postnatal. Now you see, prenatal means the health condition of the mother during pregnancy. If the mother has been exposed to teratogens during pregnancy, okay, the mother has taken a poor diet, the mother did not take a proper nutritionist food, the mother have consumed alcohol, tobacco, or other, drugs, then that could lead to mental retardation. So this is secondary. Primary mental retardation is what? A type of retardation which occurs due to factors like chromosomal anomalies, changes in the number of chromosomes, okay, any genetic factors. And secondary mental retardation is what? It results due to the environmental conditions, both prenatal and postnatal. Prenatal, I have already told you, it depends on your maternal, health. And postnatal could be if there is during cesarean, okay, if what should I say, if there is some mistake with the procedure, right, or if there is some infection to the newborn baby, that also could lead to mental retardation. Now this is known as secondary mental retardation. A number of behavioral strategies like reinforcement and token economy. Now what is reinforcement? What is reinforcement? Can anyone tell me what is the meaning of reinforcement? Students, what is reinforcement? Come on. You have learned this in your basic psychology. What is reinforcement?
Reward.
Yes, reward.
Basic rewards to any activity.
Rewards. Yes, ma'am.
Yeah. So when mentally retarded child is showing some improvement, if reward is being given, then that will motivate the child to engage in desirable behavior. Okay, that is the assumption behind reinforcement. And token economy. What is token economy? It is a technique that is used in behavior therapy, where patients, what they do, suppose a group of patients are asked to do some task. If the ones who are successful at doing the tasks, they are given some tokens. Now these tokens can be exchanged for rewards later. Okay, when, like, you get food token, isn't it? If you give the token, you get the food. So the same thing, token economy. Based on advances in knowledge on the nature of learning have been developed to help and improve. So these two techniques are found to bring certain improvements in the condition of condition of mentally retarded children. But again, here an important thing that is to be noted is that only the children who have mild can be treated with this method. Not only treated, can be improved with these methods, but the ones who are profoundly and severely retarded, they do not, and therefore do not need total. Okay, now this with children who are profoundly and severely retarded, these two things doesn't work. Today special training programs have been developed in every, now you will see, children with special needs, there are schools. So this particular programs, what they do, they aim at improving the intelligence and the adaptive behavior of the children. Their ability to learn in the classroom is enhanced, and more recently, even to enable them to study along with normal children in normal schools. See. Now again, this is only restricted to, please don't forget, this is only restricted to children who are mildly or moderately mentally retarded. This is in contrast to the earlier practices where they were isolated. আগতে কি হৈছিলে? When you see that a child is mentally retarded, you isolate that person. You do not let your children, mingle with that person, and left to degenerate, or even the situation where special schools were established to teach these children. Now, আজিকালিৰ special schools and previously the special schools, there is a lot of difference. A movement came up which is called integrated education. What is the aim of this integrated education? To develop skills in these children so that they are capable of studying with normal children in normal classrooms. Okay, nowadays this is being given emphasized on. You are to educate the child properly through using different strategies. You have to improve his learning skills. You have to improve his adaptive skills so that he becomes capable of learning with normal children in normal classrooms. Experiences have shown that this is a distinct possibility, and many moderately mentally retarded almost reach the level of low average groups. It has been shown that many of them can gain from training in simple occupations like tailoring. See, many mentally retarded children are being capable of getting a job as a tailor, in printing, bakery operation, and can even support themselves economically, thus relieving their families and society in general from economic burden. So what is seen here is that these children who are mentally retarded, after training, they are able to engage in different occupations like tailoring, printing, bakery operation, and can even support themselves. Now they are working, they can earn so that they can relieve their family. Now their family no longer have to take the entire burden of the child. Are you getting my point, students? Am I clear? Yes?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. The importance of this can be appreciated if we understand the fact that many retarded children belong to socio-economically disadvantaged section of the society and poor families. But the sad part is that many of the children, they belong to the lower section of the society. And this could be attributed to secondary mental retardation, where the mother is being deprived of a balanced or a nutritious food during pregnancy, which has resulted their child being mentally retarded. Okay, that we have studied in secondary mental retardation is most prominent among this particular section. Such families cannot bear the financial and even the other forms of burden. So this becomes very burdensome to the family. They cannot afford for their treatment. In fact, malnutrition is another factor that contributes to mental retardation. They cannot support the child with good food. Neither the mother can enjoy a proper food during pregnancy. So all these things contributes to giving birth to a mentally retarded child. Among other factors, apart from genetic and chromosomal anomalies and toxic infections, brain injuries, endocrinal factors like thyroid deficiency, lack of prenatal care, and a few others have been found to be associated with mental retardation. So if there is any kind of infections by bacteria or virus to the newborn baby, if the newborn suffers from any kind of brain injury, not only newborn, if in your childhood you suffer a brain injury, then you have thyroid or you are lacking prenatal care, and a few others have been found to be associated with mental retardation. Again, inadequate supply of oxygen in the fetal stage. When the baby is in the mother's womb, if there is a lack of oxygen supply to the fetus, that also can result in a condition known as anoxia, which is also a very, very important correlate of mental retardation. From a medical perspective, mentally retarded subjects have been classified into a number of types like cretinism, marked by dwarfism and physical underdevelopment. Mongolism, known as Down syndrome. Have you seen a Down syndrome baby? They look similar, right? They have stubby limbs, then flat nose. Yes or no? Have you seen children with Down syndrome, students?
Yes, ma'am.
Then there is Mongolism is there, which is also known as Down syndrome, where the skull is shaped like that of a Mongol. Then there is hydrocephalic, indicated by a very disproportionately large skull. They have a very big head. Okay, and it is due to the accumulation of excess of cerebrospinal fluid. This is a fluid. Excessive accumulation of cerebrospinal fluid inside the skull can lead to a condition known as hydrocephaly. Then there is microencephalic, a very disproportionately small skull. This is a condition which is opposite to hydrocephaly. This we will come in detail. Okay, we will study about this classification in detail. The advances in knowledge in different fields like neurology, biochemistry, psychology, and education have helped in developing a number of treatments and therapies and also helping and rehabilitating the mildly and moderately retarded. Now, due to the advancement in the science of neurology, psychology, education, many strategies have been coming up, many kind of treatments have come up which can help and strategize, the mildly and moderately retarded children. In fact, such people today are in different jobs along with normal people, though they are a little slower in initial stages. They are also leading a normal life now. Investigations have shown that such people are able to learn, they can adapt and adjust themselves to achieve several levels of performance. Therefore, they are no longer a burden to their family. So is this clear, everyone? Huh? Before going to the level, I want to know if this basic knowledge about mental retardation is clear. Students, is it clear, everyone?
Yes, ma'am.
Yes, ma'am.
Ma'am, I had a question.
Yeah, Shubham, please go ahead. Tell me.
Ma'am, okay, ma'am, how we can consider a common reason for the mental retardation of a child? Like there will be could be more cases of prenatal effects or biological or genetic effects.
Yes,
So what are the
prenatal
common most, ma'am?
common most is C. When we are talking about primary mental retardation, okay, it is the genetic factor and the maternal condition that plays a very, very important role. That is why we go for a 5-month anomaly scan. If you see, in that anomaly scan, all these things can be detected, whether the baby is mentally retarded, or whether the baby will be having Down syndrome. Okay, because in 5 months, what happens? The body structure, it starts developing. So yes, that is an important condition.
Ma'am,
Can you? Your voice is breaking,
we
Shubham. Can you
take
please type
like
your question? Shubham, can you please type your question as your
hello,
voice is
ma'am,
breaking?
can you hear me?
I can hear a few words again. Something gets stuck. So you please type your question. Can you do that, Shubham? Shubham, am I getting you? Please type your question. Okay, today I'll wind up with his by answering his question only. Okay. Yeah, please type your question. Okay, this is a very valid question. So, if we can consider important care during pregnancy, then we can reduce the chances of mental retardation in a child. Yes, yes. This is yes to some extent. See, mental retardation is not only attributed to one factor. Okay, there are a number of causes that leads to mental retardation. Here, the question that you have directed is about the maternal health. Yes, which is a very, very important correlate of mental retardation. Definitely, if we take proper care during pregnancy, then the chances of giving birth to a mentally retarded child reduces. But again, there is a thing that if there is chromosomal anomaly, that you cannot change. Are you getting me, Shubham? If the condition is due to the presence of an extra chromosome, or due to chromosomal abnormality which you cannot change, then that factors become untreatable, because then probably in 5 months after an anomaly scan, the mother should go for an abortion. Shubham,
Yes, ma'am. Yes, ma'am.
did you get your answer?
Yes, ma'am. I got, ma'am.
Okay, so for today, I shall wind up my class. And I think soon you will be getting your new routine, okay? You will be getting a new routine. Today we were instructed to follow the old routine. So as per the new routine, we will have our classes probably from the coming week or maybe within 1 or 2 days. I will be sharing this PPT, and listen everyone, please you all go through, okay, your notes for the first unit and check if anything I have missed out, and you can inbox me in WhatsApp. I will send it to you by today evening. Okay. Now regarding attendance, I will call the thing Bibari present, right? Bibari?
Yes,
Bibari
ma'am.
present, Bonnie present, Briketa,
Present, ma'am.
Indrani,
Present, ma'am.
Priyam,
Present, ma'am. Present, ma'am. Present, ma'am.
Pooja,
Present, ma'am.
present. Sanjana, are you present? Sanjana, present.
Yes, ma'am. Present.
Mampi, Mampi, are you present? Mampi. Mampi is absent today. Then Smriti Rekha present. One please, Shia. What is your roll number?
06, ma'am.
106. Today is your first class with me.
Yes, ma'am.
Why very
No,
well?
ma'am.
I have. When did you attend?
Even the last class also.
Then who is this? QCOM DTD. Who is this? QCOM.
Ma'am, it's Bobby. Bobby Bora, roll number 1.
Okay. Then Neha Das. Neha, what is your roll number? Neha Das. Neha. I think she has left. What is your roll number, Neha? Type kori dia, type it. Please type your roll number, Neha. Then Khangimbam Mira, you present? Absent. Dobin? Dobin? Anyone knows Neha's roll number? I asked her to type
11, ma'am.
11. Okay.
Yeah.
Thank you, everyone. Have a great day ahead.
Ma'am.
Yes?
Mandal also present.
Uh-huh.
I am also present. I am also present. Roll number 14, Rajashri Bora.
Yes,
Ma'am,
yes.
Shalini Sahu, roll number
Your mark
5.
is Shalini. Uh-huh. Yeah,
13
Shalini,
also
your mark
present.
present.
13 also present, ma'am.
Huh? Pandal C.
13. Yes, ma'am.
Present.
Yeah.
Okay. Thank you, everyone.